Okay, we are back at Hot Topics in Neonatology, and we're joined by Dr. Stefan Pearlman, who is the Clinical Effectiveness Officer at ChristianaCare, and you're a Professor of Pediatrics at Sidney Kimmel Medical College at Thomas Jefferson University in Delaware. Welcome to the podcast.
Thank you.
You are joined today by Dr. Munish Gupta, who is a neonatologist and the Director of Quality Improvement in the Department of Neonatology at Beth Israel Deaconess Medical Center, and an Assistant Professor of Pediatrics at Harvard. Welcome.
Fantastic.
We were at the District 6 together, and so I feel like you had been on the podcast, but I think it's your first time.
Yes, first time for sure. But I've met you guys several times.
That's right.
I'm going to let you take this first question, Daphna.
Well, so you guys were you put together the whole quality improvement day that kicked off Hot Topics and moderated that day. So what were some of the major take-home points? We've spoken to some of the speakers individually, but it's some of the threads of the day.
Well, we didn't do this alone. We have a planning committee that works with us, and we start like in January after the last meeting, starting to plan the next one and come up with topics that we think will be interesting and useful to people who are practicing neonatology.
Actually, we're starting tomorrow, right?
We have a brainstorming session tomorrow.
It's always risky because then you're hoping that it's still going to be a controversial or a hot topic by the time you get to the conference.
Yes, it could be a not so hot topic by the time the conference rolls around, but we've been pretty fortunate that way. We had a great a keynote speaker who kind of set the stage. We always pick that person first and then kind of build the rest of the conference around them. We have 2 panel discussions in the morning. One of them was about, I know you just interviewed Dr. Nemirovsky. She gave a great talk about, we talked about term infants and how you can do quality improvement studies in the well baby nursery. And the other
term infants in the NICU, yeah.
Right.
So,
and the other one was on data.
Yep. We had a couple sessions on kind of data and tech and QI, which is popular in all conferences now, but it's partly AI, partly big data, partly EMR use. So 1 panel in the morning and 1 breakout in the afternoon. And they were good. I think those topics, we need to learn more about them. Hopefully at some point we'll get to sessions that are very hands-on and people can actually practice stuff as they go. This was still more of an overview, but
everybody talks about data, and we know it's a hot topic for sure, but we don't know what to do right after that. After that conversation has been had, so what do we...
Yeah, exactly. What do I go...
Do I just use some Clorox on my data so that it's clean? What is that?
Yeah. We try to emphasize in our conference after every session, what are things you can do next week in your unit based on this?
Right.
And with the data ones, it was a little harder, but yeah.
But we try to be very practical, in this conference. It's not talking about things that people can't somehow bring back to their unit and do.
But I think it's very practical also to identify that the work that needs to be done on the data level is, like we kind of say often on the podcast, it's kind of building the highways. It's long, it's tedious, and it's not glamorous, but it is essential for the proper functioning of society afterwards. And that's important to know, that these will require time and dedication, because otherwise it's not something you're going to be able to tackle in 6 months and be like, yep, we fixed our data problem.
You have to measure things in order to know what you need to fix. And I just want to add one more thing, that we had a big session in the afternoon as one of the breakout sessions on involving parents and families in the planning of QI.
Yeah, we always have, we've made an emphasis, as many conferences do, of engaging families as faculty for us. So every year, the past several years, we've had a couple of family members join us.
It's critical. What do you guys say when the outcomes that parents set as the ones that do matter to them, we've seen a lot of research being published on this topic, are not necessarily the ones we're used to evaluating, or the ones we used to assess in our trials? Like, how do we steer the community in a direction where we need to put these outcomes on the table, because if they matter to family, then they should matter to us?
Yeah, we have to definitely not only find out what matters to them, but also how to speak to them about it. We learned from some of the speakers that the words we choose when we describe things to them, saying something is severe means something to us because it's a sort of a medical thing that we use, but that's not the way they want to hear about it. They want to know, what does that mean?
Yeah,
right.
What is it going to mean to their child's life and to their life?
Yeah, I think from a QI perspective, it's a good question. Like, as a field, we need to really think about our measures, right? For whether they're research measures or outcome measures or QI measures. And Vermont Oxford Network and Pediatrics and other large groups are very much thinking about how to incorporate family-reported outcomes. But for QI, the least we can do as an art center, get your families engaged,
right.
Have some families as part of your teams, just to have them review what measures you're looking at and make sure they make sense to them.
Yeah, our adult cardiologist colleagues have these tests where it's like, how many steps can you walk? I mean, these are very practical sort of outcomes that I'm sure families would care just as much for, like saying, how long can my child run without needing a puff of albuterol?
Yeah, that's exactly like the Canadian folks published a nice paper recently that said the exact same thing, right? The families don't care about BPD, they care about physical activity, they care about playing sports, and like, how can you make those sports? We should just highlight the other breakout, just to give credit where credit's due.
The games?
Yeah, the games. So we had a new breakout this year.
That was a fun one.
Danielle and Heather did teaching QI through games, which was fun. So
Yeah,
that was a great
absolutely.
session.
Tell us some of the takeaways from that.
Oh, wow. Well, first of all, the first part was about measurement. We had to figure out as a team how to measure a banana.
Ooh.
That is not an easy thing to do, as it turns out. And what it showed
It's
us was
kinda
that
curvilinear,
every group kind of did it differently.
Yeah.
You know, and you had to write out the instructions to tell somebody else how to do it.
Yeah.
That was challenging.
Yeah.
Yeah.
But the lesson learned is great, right? For QI, we need measures that are very clear and explicit.
How'd you come up with this game?
definitions.
Like, you guys have a Zoom meeting, and you're like, let's...
Yeah.
Yeah, kind of.
We didn't come up with them, but we were smart enough to pick a couple of speakers who knew about these games and how to utilize them, because it really made learning QI fun, and it's things that you could use with teaching fellows and other trainees and nurses about the techniques that are used in quality improvement.
Well, and I think it's so key. It's one that we did in elementary school where you had to give the instructions for the peanut butter and jelly sandwich because the way we tell people how to do things is how it gets done or doesn't get done, right? So I think that's so critical. And I think
peanut butter and jelly,
mess up
that
a
could
lot-
be a good QI
There you
game,
go.
right? Like
But it's
You gave us
where-
an idea for next year.
But I think that's where sometimes we fall short in QI in our units is we feel like we're being perfectly clear about how we intend for things to go, but the whole staff doesn't agree with our interpretation.
Exactly right. Yeah, and this game was just such an easy example of that. We think it's obvious how to measure the banana,
That's
but when
right.
you write it down is harder than you think. Like, how do you call the outer curvature? What do you call the stop?
Or on the converse, you might think, oh my God, this is too hard. Like, we should just move on to something else. But then you find out that, like, even the simplest tasks do require a significant amount of work, and it's perfectly okay to sort of go through these growing pains, I guess. And
Yeah.
We had a fun and delicious exercise, which was that we counted the number of M&Ms in a package, and we saw that there was quite a fair amount of variation in the number. And we learned afterwards, I never even thought of this until they told us afterwards, is that it's done by weight rather than by the number.
Yeah.
So it might be 15 in one package and 17 in another, that kind of thing.
yeah, that's how they taught us confidence interval at the statistics school when I took that way.
But then we got to eat
There
them
you go.
M&Ms
That's right.
afterwards, so it was all good.
So everybody was happy. You also had another session where you Dr. Gupta, gave us a year in review, top QI publications from 2024.
Yeah, thank you for asking that. We started that last year where we just picked several QI publications over the past year in neonatology to share them. Publishing QI is becoming more and more important, right? We're doing good QI work in our local centers, but sharing that work through publications, just like research, we need other people to learn from projects that are done. On the other hand, we need to publish good QI. Like, there's risks of publishing QI that's poorly done. So that's the goal of this session, is to pick several articles that have good methods, share those methods, also identify what could maybe be better about those publications, and then hopefully inspire folks in the audience to think about writing up their QI.
So we
Any
reviewed the
articles you wanted to
we
highlight
reviewed the
for us?
literature, and each of us picked an article that we liked, and we gave a little short 5-minute presentation on each article, pointed out the strengths of those studies and where they had opportunities.
Yeah.
Very cool.
Yeah.
So what articles should people be reading then?
Well, so this, I wouldn't. We call this session top articles. I don't think we should call it that. We should just call it selected articles or something. But there's
Fairly
one
good
article
articles.
Yeah, reasonable articles. One was about nursery QI care, matching our panel session. One was about preterm respiratory care. One was about an article from India about sepsis in an Indian unit.
And that's something that's important about our meeting too.
Yeah.
We found out that about half the people who attended our session were from outside of the United States. And that's just wonderful to see. And so we try to, when we can, bring in international speakers or talk about international studies, because I think that's a big part of QI also. It just not in this country, it's happening all over the world.
We were just talking about that a few sessions ago with collaboration. That's
Yes.
the key. That's the key of the future of research.
Yeah.
And you mentioned it briefly. were you going to say something
No,
else?
I was just saying that's one of the very nice things about having our quality day be part of the larger Hot
Yeah.
Topics conference is the very international flavor of the larger meeting. So
sure.
good for
And you
us.
close the day, like you said, with things you can do next week. So what are some things people can do next week
Yeah, yeah.
to work on QI in their
Yeah,
units?
yeah, we had a good list. Like our morning keynote was Danielle Arrett, and we asked her to speak about innovative areas in QI. She identified 8 areas, and for each of those, we had some things you could do next week. For example, I don't think we can get through all of them, but she said, look, we should all be thinking about health equity with our QI efforts, right? So a starting point is make sure you're taking your data points, your measurements in your unit, and stratifying them. Like have some ability to take your whatever measures you're looking at, BPD rates, breast milk rates, and see if you can stratify them into populations just to start looking at disparities. So that's doable, maybe not next week, but certainly the next 6 months you could take your quality dashboards and stratify them in your units. So that was one example, and there was a good list of others. Some things we did acknowledge that this is going to be tough, like, BPD rates have plateaued.
Ambitious,
So improving that.
Yeah.
More ambitious,
I like that.
not tough.
We should have done ambitious instead of tough. Yeah. So,
That's great.
And then, sisters, we're closing. My last question for you is why is it important to have a full day dedicated to QI work?
Well, what I would say is that there aren't that many meetings out there that are available about quality improvement in general. And specific to neonatology, this is really the only opportunity that people have to learn the skills and see what topics people are working on, learn from them, bring them back to their own unit, improve the care they're giving. So I think that is really our motivation, is to try to bring that to people, because there really is no other meeting that offers that.
Yeah. Obviously, Vermont Oxford Network, like that's been a very big organization for quality improvement in neonatology. Their meetings are hopefully coming back, but at current time, this is the meeting. I think it matches the Hot Topics audience, right? The Hot Topics audience is fairly clinical. They're taking care of babies. They're in units. There's researchers here as faculty, but the people who come want to take care of babies, and QI fits in nicely with people who are taking care of babies and families. So.
Well, I think that's such an important point. I think you don't need to be a QI researcher to do QI.
Yeah,
and in
exactly.
fact, it sounds like, everything we're doing in our units is amenable to QI by tracking it, making some improvements, and seeing how we do. And I think people don't always consider the work they do QI.
I think that is a terrific point. Like, who is it? Paul Batalden had the quote, anybody has 2 jobs. 1, take care of patients, and then 2, make your care better. So I think
love that.
it's a really good point to make.
In many instances, we know the right things to do, and we think that we're doing them. But when you dig deep and look at it, you see that not everybody's doing it the same way. There's a lot of variation, and there are improvements that you can make to make sure that you're immunizing everybody before they go home, or whatever the issue is.
Dr. Pearlman, Dr. Gupta, thank you so much for joining us.
Thank you, guys.
Thank
Thanks
you.
for all
It was
the
a
work you do.
pleasure.
Fantastic.